TAPTAP said. Oh, I was my baby, you're from California. The only boss. Wait, one is baby, I will be everywhere a day and everywhere they go. TAPTAP send got me covered. It was therefore if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP send. Okay? But also, when I receive my money, the other time I would channel, like my view, no, hey, you crazy. Download TAPTAP send now on Google Play and App Store. TAPTAP send, it's secure, convenient, easy, and fast.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
A very good evening and welcome to OT Health Talk. Every Wednesday, be a Yedijumedi Ebro and Dr. Kos Abina and Dr. Kwajo Omo Enihanomo in teammate Tinemu Ede Amom Omoba Beto Jumedi so. Now last week, Dr. Richard Eghan the Nkomo Efa problems when it comes to sexual health. Any nyame ayadom wasan ababeken ho ayebabetwetwe enkomo afa fertility especially the problems that is got to do with fertility in men and women. And a doctor ababeken ho enti yebemna kwaba na yefiti jumedia. Doc, enyumre emwajo emwakwaba biemu esan ede oba jumedia so. Doc Mbacho, you are on mute. And yes, I'll meet you now.
Okay.
Nice one.
We'll start coming.
Yes.
Good. Yeah, tie de nyame ase se waboye ho ba hwe so ama fencing da pen ba kwa sama beto yen. I just said that pen ba kono 1 week and now 7 days. Enti de nyame ase na menso na maye krado esan se na me feel say na minim susu say mo be friend Dr. Richard Eghan for the second time. Esan se program started na ye wie and our face so and same baby who are near and can we
Yes.
see them in himself no member program is so and in tina me the my crowd are me train say metamunka inti many I just say musa invite me bio na say omwa omuni me di omuni me ono mo so omuni me so no na chese omuni me inti me Dr. Richard Eghan, me integrative physician and as a medical doctor. Me sounds so a year it sounds so a global health expert and as a consultant. Apart from that, and so me receive award be Ghana. Me canning na me se me candy and near me sister me dine chino near award a maju money a woman a beje papa. Enti the American can one say me sounds so ye Pan-African health ambassador and no me receive or Ghana. Enti na I was say me bosso a can home be when the paya dia or say ye every before na ya na top break bia aya na yemfa ye nuanom a omakwa animu e wo niema bi ho yemfa ye serious na sebe me yi say TikTok and I say Facebook obi ba no so kire ade wo ho a me susu mekwa akokosua bi if say nipa no e bia ni nimdie no ebro media so e wo TikTok, Facebook, WhatsApp and now say the keka ho Instagram ni de keka ho na yen no ho ano aya na den say eni pe kita nimdie no na yesua de akwakire no aya na yentai enya sa invitation na akwanya no a yen susu nimdie ayewo eni eniema ayaye ni niema yetumi ye no yetumi ede betu dwa ede boa ye nua no ye de health scientist ye medical practitioners and medical scientists and ye sanso ye global health experts and consultants enti de ebe hunu bia na ebe boa ye nua no ye call research mu ye call baby esua ade no na ne ye be kwa kofa ho bia ebe pese nka sabre afi na me clinic consulting room amabedu fie nka bia me mfa sabre enfanya de me nka me de best spend it with my family any nipa omo pema sem na me po ho asem na so me jani nyina chiribie ababe kamonsa se be ya monsoso university be miensa na 9 ayekosua ade no kakra yewo from research no ye ne mo be share enti ba me ba ye maba ne say me ne mo be share research kakra yenso ya ye over time yenso fu se be bo nipa bebre enti share nei meaning say ye ba be ka infertility problems natural say ye ka infertility a ye wura mu na afi se bre ne kodada ansa na ye wura mu nti na wo se ye hyase preko ye wura mu die na ye ka infertility problems ene ne keka ho ne kofa infertility na just say ne ye ka ho asem otwi kasem anase ye kasa a enipa bebre etiase sana mpesmeka ejesame nkanse kasa bi echen kasa bi na mo me kan say kasa enipa bebre eti me asantini sanso so ye mfantini if you asante esanso so fi Cape Coast mfante inti kasa ni mienu nyina no A banner so was said me mixing in you, no, make my mixing in a then make a quack and say, me can't somewhere better my see a cake. And until the boss as so. And to see a cancer will be what infertility. Na ye don't want to quay, na ye train, na ye we see any more time, no near per se a child say. Say any pam you know, or barney bema. Etimi etna. Omitimi be 1 year. And a feba 12 months. Na say omu into me and wo ya. Womu enuma drobia ye friend contraceptive. Contraceptive. Na just say adea ekuntia insane. And I say nipa mienu betimi awo no. Na just say you feel so nipa nanya infertility. And I say couple ni nipa ni mienu no enya infertility problem. Me repeat it. And I make a protocol seminar Simon repeat it. I will dream or say the inability for a couple to be able to conceive after a year of trying without using contraceptive means to say this couple are experiencing infertility. Not just say, this is the meaning of infertility. Esan say ye nipa mienu ne come ma 17 no. Ma ye me notes ni nyina wa ha. Ti me starting in kakran no ati ase. Esan say akoye nipa mienu and a formal couple. Oba ne bema and a war. Inti say nipa yi be yi ni maako omo causes they could hear far by and I said they could hear far problem by na ya yako baby ibinya emwa eni ne keka ho inti si ekọ ema no mu a eye infertility in women ma aside no. First of question and I said first year edema yen e won notes no when they say ovulation problems. Ovulation. Naturally says so your ba na se wuntimi ento kosua. Say ye besia nentum ento chefua. Say besia nentum to chefua. We your ba no ntimi ento chefua and asa kosua na o problem. And then the plan be so no your friend no irregular and now say absent ovulation. The church mupa sana mi emejuma. Inti not just want to kushia dia miniaba enya dia ubetumi awo. Se kushia ni bi any ho sense so irregular. That means some months be why it me ba. Ovulation na yeka wansem no. Na some months be on so into me ma. And now say a completely absent e makra. Say madia na dia na kofa by. And I say irregular so e dia na timi e kofa ba. The thing say only pebia say we ye period. We your ba sorry. We your ba now your period. Na say a regular. You can say obi a regular period pattern. Na you nipa bia month bia no ni okoni period enye different from the last month no enye too different se be pa ho kra kakra bi mpo bia be 2 or 3 days pe ana se be ba ntem ko be ba 2 or 3 days pe and say bia ko 10 days and now more than that and you say ovulate offense period no ma yi enye regular dia sana ovulation no so etumi eba ovulation yɛ a period from the timer wobɛyɛ wo period and now bebu nsa ekosi timer 14 days after that period no but what any ovulation ye ebra wobɛbu nsa now what kind 14 days sabre no ye expect say so wo kosua ni bi ana kosua ni bi aka wo mu and for some reason kosua ni nye adwuma kra na say whatever it is sa period no na be kire so wutu oba wutu kosua sa period na maka 14 days after and from the day we year period no kosi sa 14 days no around day 10 to day 14 no aya na ye say a horna ovulation no anase kosua na osese onyankopon bo nipa oba sese so oto no sa period no day 10 to day 14 ayire sokra day 15 ayire sokra no e was say utumi eto sa nkosua no from that time sa bre no so na se be ma ne woda obetimi no awo because sa bre no se wohwe graph no so a na ovulation peak no e was soro papa nti se opese no yire o girlfriend na obi are ne tie a mo pese mo wo a e sa period no e na mutime wo esanse ebinum de ne irregular meaning say eba this month time period be ba no the next month na sesa e hono e tricky kakra but obi ane de no eba around in any the same time po any the same date po na around the same data your friend say ovulation no aya na any different from what you had last month and when your friend say a regular say any regular a confusing kakra enunti so person we your banner person wa. You see, you need to see a professional. The same year, a lot of research on fertility and reproductive medicine. And say, untimin tokusia, ayeka wansem na, and now untimin ya ovulation, problem, problem. Ewo awo ankasa nsem ho. The second one fallopian tube issues. Fallopian tube no ye tubes mienu bi a ewo ho a ewo baako right side of wo system no baako left side. So nyame ye wadom na mienu no nyina ye adwuma na ekwan de demu a ekosua na wobeto during year first ovulation no ebetimi afa sa drobin yenu no mu tubes se etimi fam sa akosua na woto no eno na ekwa akosia sa woni be ma ada the time year first ovulation period na sa tubes no yenu mu na wo kosua na befa wakwa eden wakwa akosia be mano ne sperms no be mano ne sperms no ana ne sperm no enti se yesi ubeko hospital ni e ka kire wo se o fallopian tube no oba na make was to me so fallopian tube no ayeden a block here o problem o infertility problem and here number 2 and I will be a friend endometriosis. Endometriosis. Say it kind of say it is a condition where tissue similar to the uterine lining grows outside the uterus. You can't endometriosis and you can't say your tissue should be a bano. Ewo your friend said your friend no uterus and I say womb no awode wo no ana womb na eba bedam a etimi ma wo etimi enyin na otimi wo no se sa tissue na ewo womb no mo no ana lining na ewo womb no ewon ko ana kese se ewo but obi o hono na ne de ani bi e develop ne womb no tissue na make kan fe fencing endometriosis meaning say sa metriosis ni ye tissue bi a anka inside the womb pe na what say ewo. It is a kobani say if it is found outside the womb they develop outside the womb, it means to say a background to me kokodemu outside the womb. And on Yankupon body and so no or boy say womb mu pe womb na kwen what to say incubator. E mu pe ena a ba betimi ada na we develop na waye pani ama oba be wo no a wo no enti se wombu no mu no se fallopian fencing sa particular tissue na me can say e could develop outside the womb na or problem and also another cause of infertility oba de na me can me repeat me cause there will be a friend uterine problems. Not just say you can uterine problems now. You kasafa womb na kasa uterine no. I refer to the womb, and I biara I refer to the womb biara no. You can kasa mu say uterine and a uterine. Into within the uterine no tissue na I say you will be bit your friend no fibroids. They say what a fibroid in that now your bow fibroid there. Meaning about me can't you say it can cause infertility in you. So your bar now you friend saying fibroid it makes me cause infertility problem. My bobo near mommy and said this mammy come and me cranka home. Me the kind also say one of the main causes of oba fertility problems, ovulation. The second one we mentioned maybe say fallopian tube are blockade. The third one we mentioned maybe say uterine problems. Uterine problems na maybe one say komoyi. I say so fibroid depending on the location. Baby crow fibroid ni da womb mu. Nefi the size send ni kese etie. And a bed determine say ubetumi ayeden awo and ubetumi put a holdy baby for 9 months or not. There are other things and your fibroid in but fibroid na oye popular among all some of the things a womb numa a cause problem. It will be able to set scar tissue. Scar tissue ni will be a why ye 7 previous abortion. Why ye be abortion. Na enkeka wabi nkete bi ababa womb no. And apart from that, you will be a friend adenoids. It will be being so your friend no. In fact, there are so many I can't even count them all. Because of the time limitations, no. Your hormonal imbalance, and also your dear being, will be any hormones. Your free or more progesterone and estrogen, and only the major ones, no. We will be a hospital near Becca say, your friend is saying, other hormones, but these two are the main ones. That's what I'm trying to say. The two hormones here, estrogen and progesterone, no, say, and yet balanced. Na ratios, no, bro, the normal ratio levels, no, it may affect fertility. Apart from that, obo na near say it be our thyroid, minimum hormone. Your gland be your friend thyroid. and also produce and a security if I saying chemical be a friend or thyroxine and also so near Jumedia and also so it to me a cause it can say to me a cause infertility into hormonal imbalance as some marking into Sawako Hospital and I'll call GPO and I'll buy me Dr. Richard Eghan mentioning Nasa Mekacho so when your hormonal imbalance and also see one of the causes of infertility in wo obano. Another factor the decline with age. Fertility no, you say naturally no, a decline with age. Meaning say, no, fertility levels and so echo form. But you any year, we get a pen at training at all because oba would na making the causes of female and now oba infertility. And you know, the maboboshi you could understand. But then again, may come back to hormonal imbalance no kakrebi. Nema boy yari bidding and sana yakwayening with the age, no. Yawa yari be a friend of polycystic ovary syndrome. Mumbe brain ebi amati said ayana yentam kandini ayana ye type chaso no PCOS. So PCOS no and so can be caused by hormonal imbalance, and this can negatively impact fertility. My boss my cultural fertility declining naturally with age. Into me call the next one, and lifestyle factors. Or lifestyle. A quite a first one will lead or life. And then my way and ma also suiting it we are no. Obi o hono mo a no fast smoking. Onum cigarette. And now on no near my name maybe can cigarette home. Obi o no alcohol consumption. Onum sapa papa. Onum sapa papa. In fact, or depending on alcohol, any other types of drugs. And also so your bar now ye beer. A bit in fertility. And now your free be obesity. Obesity ye. Kesie unipa aye abro. The normal saying height measurements. Any also no the body mass levels or height. Any body mass index. Say a bro mpempensobia and ye cancer unipano aye obese and also suffer from obesity. And now your medical conditions and so on. It may a cause to female infertility. It be irregular menstrual cycles and now absence of period. Into your bar now own tie a period on a regular basis. Meaning say, ebia this month, unyano on the 8th. The next month, unanambe on the 15th. And that's on the 8th, and on the 1st. Now a twaswa and you can say a cycle because a twatwaso a idea measure who say and yet idea happen once and for all, but a idea a year continues. And then so we can say menstruals in irregular menstrual cycles. And now say you will also a kind of say absence of periods. Absence of period, no, the medical word for it near amenorrhea. Amenorrhea, meaning say period menorrhea, meaning say period macra. And in either say irregular menstrual cycle or complete absence of periods, and obey to me a create infertility in a woman. The next one here, pain during intercourse or pelvic pain. Pain during intercourse, ne ma would modiano, bibi a friend of dyspareunia. Dyspareunia. A very, very funny word. Obia was said to see bono. When it comes to one thing, pain during sexual intercourse. And now say, apart from that, obia or pelvic, ayasiare, pelvic pain. It sounds say, pelvic pain, most of the time, what clinical setting, test me and you say, obia na ya sita ye ne ya say nipa most of the time, not our infection. To be a hormone, that's a nyani period. And now say, na ya siya ni ya, and now all your sex and ebe ya. It could just be say something is not right. And si nipa ya na omodwin say sex ho eba no fertility ho asemo a simple no enye simple at all. And I say one check it, no one test it, no one regular health checks and so on, you would never ever understand how these things work. And the advice, another key word, they say, Onipa, obeye regular health checks. Say, especially, obi a opesa wo yi owo. Popular, mo pesa mo wono. And yes, simple, sir. There was a time when they catch you, be me share patients, be. Me, Dr. Richard Eghan, my main muscle will say, and near man between you who juma pa. Ebinomo ene awo maboa enipa bebre sabi omo kai me na omo etimi edi adanse fa enema amaye no ebi be catch you say Dr. Richard Eghan dear one of the things so ye ho adwuma pa ya awo na waboa enipa bebre me kai say enipa aba me practice and an clinic how Lewisham London South East Hanono on the high street, Lewisham High Street, Omodoso pa. Nemo di atiane say, so we started a treatment, na we and now we kosu baby, na we jaya, minia bema, unya benefits na we need, outcome now we on sanka. I just say Brenna ya shama uno ultimi complete nempo u started first cycle nempo not say enyema nko yi amawa omo ayabo omu nyina UK hanomo Spain Netherlands Germany USA any other countries are mema boa omo no bebre no omo tokoswa kopemo say ya bebe yo madom esan say the causes of infertility many wo can one say no. Yes, Oba, according to scientific data and research, Oba won't be go, Oba, wuni womb, and now I would dear anyhow. Any other creating a me and him. Magic pet and unipani beti me ama what me at their war. I mean, repeat it and chrow. Onipa, wuni womb, and now wuni I would dear, I will bet me their carry baby. For 9 months. Na enye bi sum koyi ka ho no. Mo pani ni pa munti mengo. If you say wo here womb anasa wo de etime e de awo. Enti ho na mpese me cho say me Dr. Eghan no, o ma mabo wo no. Obi ho a you see ni age after 40 after certain age ontimi enye de engo. Me Dr. Richard Eghan mabo nipa already 45 47, even up to 50 years. Me akasa, me research data na me de ma wono. Me clinical research amaye, and I'm able to actually only be no. Ain't yeah, no ashemenso. Now, we say, okay, you na doc, we say, what can symptoms, and what can causes, na treatment, MRD, it's the same. Hina treatment in be free. Na me Dr. Eghan me catch will say to address hormonal balances and now say to improve certain qualities. I will say yama enro. Yama hormonal imbalance in ro. Me clinic one oba. It's not say me treat too. We your bana me treat too for fertility problems. Me call into those things. I go there and search for medications that can help you or your hormones to balance. And here, number one. Na afe no, ma share, bebiara sinto, and a problem wo. Na a honsu sunru no, mediamao. A son say a hospital na wo kwa. Who problem be to say blockages within your fallopian tubes. Most of the time, no, I na see a catch that will say, fallopian tubes are blocked. In most cases, no, I just call hospital now on surgery. In most cases, you will know how more a timmy boa. Then so maybe me casa no natural say. So what hospital me a natural say. I want to me no. I will your bano. A free offense blockages within your fallopian tube. Maybe Dr. Eghan, memoir hospital. Na ni omo be ye no. Me so media me nimo no media ka ho ama. Se enya no a na enuro adbia me nim se enuro nkuto ebetimi aboa wo no. Meka achiro. But ni nyina ne se ube continue treatment no na won konkoso baby na wunyai. So when you start and you don't complete the treatment, you don't get the outcomes and our benefits from our treatment. I have to tell you the truth. Obi biara waba menchenya onya ni ohwehwe in terms of our outcomes no. Eye obi a wentimi an complete treatment no. Na okoduru baabi no, one and continue. No jamu. Cause me wonipa wada die pa me se me hwe na me hwe won so a obi oni mi be ka kire wo. I say, I have time for my patients. Because the science and the art of it. And see, so what about me chain? No one the over near foot to Edema and they say, Ubede, Ubeto Boasie. You take your time. No what chain. No what take every instruction that we tell you seriously. And do what you are supposed to do. Now, me babu bonye ma bi so ade a kire wo. Me kidi say within 1 hour e bit maybe our programming. There were other courses. Now, before I be call a hono, you be call mail a mema and so ye de.
Doc, we there. Doc, we there mesre. Looking at the time, you know. Yemfa emema die no emfa nko next week na yem focus on emma ene then nyenya kwan na enkofantimi embusa questions na before so obeto no when it comes to treatment no now we can about emani treatment no at what point and I obeka say ebia mama ndro the surgery mama surgery na baby edu there you can consider IVF. At what point would you say that?
Yo, thank you. Before Oba ko akoye and I ye be more ba kwan Oba ye no and I made sure of the clinic how London hano. Ye man kwan so nkonko IVF no. The timer or what problem with ovulation. The timer, forgive me. The timer when your blockages. Ovulation there, sabi obe here the ovulation and sana, cause ovulation na ma kosia ma. And now ye Eghan anti no. Obi any hono kwa ji obi kosia say, cause ye nyina ye ni nsam sisi omu. Enti no so tu kosia nko ade a. The only thing that limitation and the ma problem say o fallopian tube na sa kosia no be famu naturally. Obefamu no de akoshia sperm no obema the sperm. Se wo de na blocky na surgery aye be de bie mu no anye yi. And the dread de amount say and help to solve fallopian tube blockage you know anye yi dia sabre no ena sa assisted reproductive technology aye friend no IVF no The name for it near ART, Assisted Reproductive Technology for Reproductive Purposes. Inti sabre no a wo kusia ne bi ho ene ye call ovaries mu a ye hu se kusia ho ena ye friend say bosumi bi anso so to sa kusia no eye wo ovulation date no but some blockage na wo fallopian tube no kusia ni ntimi mfam ena kusia fallopian tube so ye mienu eye two inti se ja ba ko anje wo a ba ko betimi anje wo. Now here's the case I would the any me no tubes ni nyina block it. So me Dr. Richard Eghan, me see me book as ask me sure say so ba the chain now fallopian tubes no me no ba ko ewu mu e na block here. Ba ko aka no e ye okay a metimi amwa wo. Ne nyina ne abotre. Oma mabo mu nyinara, oma mu kita ntafo, oma mu kita all the people I've helped, they listened and they waited. And they listened to instruction and we tell them what to do. Omo went to me and train, now omo opted out in terminal. It didn't help them. And see, yes, the answer to the question is say at the pointer, oni pani tube na koshiani betimi afamu, akwa koshia sperm At that point, say nimi enu enyina a block the correct. There is no other way you betimi transport it or over and our ovum no. Edi akwa koshia spermatozoa and as a sperm na fertilization etima take place and it yentimi and guarantee success to that. Nemo say nimi enu block the ye ba director will say. Because we work, I'm in a private practice, but we work with NHS. Yeah, ni obiara obeonya problem no. Yeah, refer womo. There's a 2 blocked fallopian tubes and you may cramming with same time. Mema refer and I catch yourself koho na omo en the omo beyano. So muntimi nye dia and yet the only recommendation is say ebemo akwakoye IVF. Ye bet you kushia no ye be ye na ye de beto tube mu na omo aye ho ne mesese omo ye ne dum pempenso bi a ya sign e dia sign implant and I sign dia ba beto owumbu mu sene anka natural ways anka be ye pepe but we artificial sister me guarantee say 100%. I have to tell you the truth. Now, can I see a catch or sequoia IVF for social IVF for no boarding? Fine. In fact, me tea ya crying chair, not 10,000 with Timetia. Entina, say no, a unya blockage biano. Come to Dr. Eghan. Obi by and chain, near catch and say, better address say. Oh, the doc in the boarding. Wait, they say, yeah, ye, sister, brother. Send pana Bruni Hospital near Captain Zonko IVF 10,000 Obeshi Egu table no Sisi. Why do we do this to ourselves? Ebi I was starting and many one shots here. And Kasawu to me at Waso, etia eto no copim pempensu assassin ya and Kabia and then whom enko hiampo say Ubequaquesa 10,000. Sase quite minim meti 10,000 I check. And our consul there is an instruction, there's a year for an agreement. I was on the hospital, and I said fertility clinic, sorry. The fertility clinic, only on agreement, a bachelor said 50-50 chance. 50-50 means, yeah, fine. And yeah, fine. Yeah, the AC canon, yeah, benchi. And only say 50-50 na, or more canon. Yeah, you know, kuchiada. Maybe Obama in China me catch and say, "Ontia 300-500 pounds." Krana main talk a drum no board. Tini I mean him say bebuanoa. Eben sembebre. That no board do. Where yet? In Cebu one 200. Ebu one 300 pounds. Ebu one 400. Actually, so great 400-500 pounds. A dwelling board tini. Me catch any almost say. If we are saying, I dear friend, health is very expensive. And I will pay quality health and a health care. I say, Nipana will ban a name sebi or your cromini. But me underestimate, men fan say, oh, I am a cromini, the way, and dear no name. aya underestimate ye hototo ya maya fire no mumu toto abrofu hu yen ya bro ni me ko program bi ase na enipa krachi bi bro ni bi sabe me hwe be qualification na niam amesua na me hwe sa nipa no ono ye kurumfo bibifo gu ne nchen ya kwaya fair fan program bi health expo na me hwe sen kofui akwa susu kura no sabe producer de ye sua ne yadru no ye chemu be tena e no kita mu baako aden ye sa o Ghana need your bedi usika o Ghana need the whole kwei o kwako bu afaso ene ye dia se ye tirimu ene edi enya ene ema ye ni respect o wi ase ye ko be obi aka de ope o wakwa bibi need your kwako twawo o bibi need ye wo be twawo ho o krom ni Ghana need ye enkosi hu ene ya ma aka ho enti ye ka kwako si se oba ebetimi aboa wo ye de ne se owum eye adwuma yie fallopian tube mienu na me kan ye no enso ye adwuma yie ni aka no wo de gyamu ma Dr. Eghan sa niema na aka ni nyina no hormones no ene de ka ho nyina wo de gyamu ma me na me ma wo nuro na koso afa sa nuro no wo ne wukunu because enya nipa ba ko ne ye hwa no e ba ne fertility ye hwe couple 2 people oba ne be ma Mummy and Numunye ready say, Adiana Muslim, you want it, you mean it, you really, really need it. And yes, I will aquasiko, no bedi Jiran Quentia. Oko start take a carrying with a make up, with your mommy, may call hospital. Sika be obekwa ye bit obetia. Once for your bronidia or the big good table susia. On Jim watching yet, no misa question bako, obetia in Amano. Yes,
Doc, it's an emraining tino. Yemfa emani dieno insia na yempeke questions. We've got about 10 minutes to go. Yempeke questions na nyame ayaduma next week, yemfa emema edie na ebribe mua yebesan ya pebre na impo yebe focus on some of these key points are ode eba yi ehun bibi this IVF yebetinya focus talking about IVF and in some of the hormonal imbalance topics they buy.
Very much so. My main for we in chat to answer alcohol because it's important to me. Some mention say, "Sa ne me amabobo so ma hwin ma problems regarding fertility." No, apart from that, me person what you still say, research actually and say there are other causes of infertility apart from the amabobo so ewo ye niam no. You will be beaten say ABO, blood group, and a blood type issues. And no research actually say, and shada enye very much proven. Also in science, are they proven over and over again? Yen kasa emfa bebre. But there's a little evidence to say, obi owo type A blood, type B blood, type O blood. Ebetumi cause infertility when they don't match. But said American mesrewa. Me a researcher and tell making disclaimer and say, men country will say ABO blood type between a day. I a predominant cause. There might be a little evidence in science, and in research, you can't say little evidence. Na yen can say, and then the major cause. Nemo you will be a friend of resource factor, and that's a resource disease. And no ye proteins be a what or red blood cells a red blood cells surface. Say, oh ye positive, oh ban we negative. Now no because of ne papa a blood group unti e be no resource factor A. And now resource factor na wo ba no we negative misrewa and no nebitima cause problem. And why? Because o first born no your first child no ono no resource factor wo ba no ni bi we negative. Sa ade no o immune system na soldiers na fight the area ba o body mo no omuhu resource factor they say non-self protein ana bibia say wo oba no eba wo body mu a non-self omo recognize no I say, yeah, Ghana, near Kwakopia, America, and Bremer, you are not you are not recognized. And I say, Obi to one more, say, hey, Debbie, Ghana for winning Gada, you are not welcome here. And to Sana, resource factor, no, Oba no body more, so no Nibia, your friend said, oh, yeah, what we're creating a situation be in the body. Because first time, no, immune system, no, and fight, no. Nemo oma form ho adwen akwa we say biosaba system mu a ye be form antibodies near their fighting near they destroy no. This is what we call the resource disease. And no na say what first one po na say what second one na second baby no e wo resource factor na say resource factor no it mean a baby no. It is one of the major causes of miscarriages. Yes, me talk so anka oyembe hwehwe eniema wo ho na ebi brain nti ma ekwan ama amanfo akasa na emom no yewie na say next week or say to aso a sansim nyina beba fertility nya simple say the amanfo hu no a very complex problem it is obo being chain for treatment nya botre na ne be kire say no do it
me that's doc. Mira say, mame endane me ho na me mfa enkrato ba ku mienu entwam. Me ba afei me fa amanfo questions a omowo ede ema Dr. Enyimre. Enti producer o ho no ma me sewa mame 2 commercials ye ba ye be fa all the questions.
Me did young antechua and maybe I'm discovered for Europe akuma busuafo wo Ghana no. Me use tap send. Tap send. No fee mobile money transfer. Eye easy, eye convenient, eye fast. And sounds so ye free. Won't ya she? Me discover ye mapim. Tap send. Entienne. Also download the tap send app no. Ewo mobile phone so free. Na fesika komu abusuafo wo Ghana fa na nyina. Tap send. Papa no. After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana.
Yes, people, still on the Joburg House and Fair and Charity Ball. We're going to be stopping in Birmingham, UK on the 11th of April. Let's go get it. A home for you, a home for the homeless.
Yo, me mama jo esan mamo akwa babiemu edo eba eye OT Health Talk. Enyumre yene Dr. Richard Eghan ena ye twetwe enkomo about fertility. Say adverta ye bo etwa eto eye Joburg Housing Fair and Charity Ball. Performing artist Samini ebe PM ehobi. Housing fair nyame aduma on the 11th ebe koso ewo Birmingham and on the 12th so no koso ewo London. Popular restaurant asabri meneo kasaidi Ajidin ewo London, East London, Juliness ehonomo ena London die no ebe koso. Se o hwehwe se obetimi ato edan ewo my Ghana mu se wutua ne cash payment plan anase oje mortgage omo ewo site ewo very prime locations in Accra and it bomodia na any Joburg housing fair for Asia na odan a wo hwe se ubetimi ato ana wo besi ewo man Ghana mu no omo mboa na omo ma ho akwankyere nyame yadom so a ochina mede omo ebeba time TAPTAP send jumedie no so enti wo pe ho ensem dodo na etia join us tomorrow on time TAPTAP send omo the explanation nyina edebebro. So Sabri ye ko na yafa all your questions and numere over about fertility or infertility discussion and numere Dr. Richard why Crado say obefa questions ni nyina and it is our Zoom no so now ma won so a mefa na audio question aba in it is Sabri yendi kan emfa ama na enti ama
what
Ama you are on. Hello Ama.
Oh, sorry. Good evening, Dr. Richard. Thank you. Yeah, that's the way I watch it. The more questions, me no be bisa. When you talk about the reason why maybe sana, I've been I had fertility issue for 15 years and sana me conceive into when it's a very exciting topic when I hear about it, because when people are going through infertility, I mean, it's a very tough time. My first question, person me bisa on say, "Who know now who use no?" The person me bisa say, "Does it have any side effect?" That's my first question.
Okay, should I open some answer? My answer is yeah.
Yes. Okay. Me person me number first one, and then the second one. So I'm person me bisa and say, I know say from Hano, they tend to use Clomid to treat infertility, and from what I know, no Clomid causes cancer.
Okay.
Is it true or false?
I'm gonna say and but you repeat the question, no?
Clomid. What kind leaflets? Leaflets now. It causes cancer. That's some of the side effects. They will tell you a minute number.
That is true.
They will tell you a minute number. But the point is, when they tell you it's a minute number, no, you know, sometimes no open by all you know is, I mean, all you want to do is to have. You want to have the medication. Does it work? Number one, personally, I would say it didn't work for me.
Okay.
And you know, as Clomid from medical, you know, you have to have it for 6 months. Yeah. Personally, I was on the highest dose for 9 months because I wasn't ovulating. I had PCOS for a longer time. And to me, my first question, the person who say, "Well, who know now you soon has it got any side effects?" And you discuss that with your patient. Number one, number two, if you want to confirm about the Clomid, what I've said now, I haven't done any research into it, but I have agreed to it because I had the treatment. It didn't work for me, and then I ended up having cancer. Although they tell you it's a minute number.
Okay.
And so that is my two questions. Some person me be so I'll come back again. Thank you.
Thank you very much. Thank you very much. Questions are obviously very valid questions. Obia Sube benefited for the answer I'm going to give you. First of all, Clomid is only given. It is only given at a point when we realize, say, a best support to patients in a reproductive system. Ama watumi ayden watunkoshia and now watumi atunkoshia at regular times. And Clomid did an adjuma ya and say it helps to produce ovulation. It helps to produce ovulation. Now, I had the entry amount for me. I'm very sad. Now, me, I only make kasana. I'm a global health expert. Me, not just clinical a doctor and as a physician. I'm also global. Global means say a lot of research. Into a grad they say what can be sir. Say unikosia say wo system no are running out. Also obebia no nyankopon bo obebia or they will kosie nyina ma wo. Obebia from the time we started say your period. Ekosi time abenya o menopause no. Ukosie de ma wo nyina de ama rada. Ebinumu eluzun kosia na entem. So many reasons mean to me moboso. Obi susu ho no mo a the fact is a man nipa bebre luzo mkosia na entem ma bebre no ma last minute na ohwehwe ba no enti so yo ba where the 35 going na yes say wo fertility index na ba form and necrad because nipa bebre nya menopause entem no kosia no eco form 10 the air can say clomida moawa and non chere bibi for friend to me. But then we have to determine say Kosiano cry a be or hall. I'll bet me at home. For baby on more quack IVF it me check it ever say Kosiano crown will be an ever colony whom it moon say a be an onoko. Now was say your could you be there and now almost any ubiko can wasem now your Jew be there either on a contract or whatever it is, and it may mean a honor me mejuma. Na ya ji obi de yamano. But se wotun go sia de a enye ye nim se clomid. Say the man now fun ye. Cause there's a date and time I was say the clomid ni yejuma. Say a man no anko yen the correct way, you know, be from the first to the so and so. Be also for 5 days. From the first to the second to the third to the fourth to the fifth of your period time. No one koyene sa and correct. Now koyene any other later data, it won't work for you. And sabi enyo munyina so na ejina de mi so. There's so many reasons in tia clomid and workima binomo. Na en workima e binomo. Enti 100 year. So oba me nche o me clinic ha na still make me treat cancer. I have to tell you the truth. Any pa nyame adafa me so ama me di nro ama wo ama omonya remission and omo free cancer mo no edoso. Enti no ene number 1. Number 2. Eye cancer na obo ubisa say does clomid cause cancer? Medically speaking, your research mo no ye be catch us say there's a small chance. I'm using scientific word, chance. Say a bit to me then a cause to such. Now, in fact, where do you kura woody? A diania woody kurano. Mokwa worry, a sichira worry, and a judidi kurano. There's a small chance. There's a small chance for certain enruaonum. Ebi I would say a herbal. And I am a think of it say a herbal. Problem be a name, sister. Herbal. A year drew. Every cross side effect to woman every woody. Every wood see a meet side effect. How would you even know whether say body crown it me accept certain type of foods? Oko restaurant be a ya trouble crack food allergy. Food intolerance. What are they telling you? And yet, it can cause a problem. If you don't know these things, anti-ampa, it can cause, there's a minute, but I'll say no can and sister, I repeat the same thing. There's a minute chance. But then what am I saying? I'm saying, say, enya nonko, a drobia wonomobia, there could be a minute chance. So basically, I develop before out of it. And depending on onipa or show ni a cra or prescribe a drone, dosage or the frequency, and then near be more. Say onipa no the right thing mao. Me question will be me catch them say a draw or no a blood pressure draw. Na antibiotic wom, antibiotic was too strong to say, untimin fan nom and sa. Untimin fan nom and sa. O chan who called roof, you know, it was a different story. Or in Saya could do Pempen so be a drone go janum. On the Bayriba back to my clinic, you know. I may assess you, mono. Or to the dog, maybe I drew with any am you, maybe my no am wame. See me, you really heard us, there be me, no. With the Yano cray. Because one will say, man, can of cray, Ube quack, come, baby. A best say, Papa Juma. I draw the man, Warno, tie the number of times I want to draw. 1 month to pet. Or catch you say, giant sanum, 1 month to pet. What you mean? Debbie. Me, my own good papa anymore, say. I say, Papa, him anybody. Now, Miss Megan anybody. I'm some massa. And in the ancient year, Jumano, one year or lifestyle. Near man, also to me, jay. Now, one no drain a year, Jumano. Went to me, yay. I know Joanna, you did dinner was so with jay. Now, and also so, to me, and yet the better effect and outcome from this treatment 1 year. And to the make say, Mimi Abana so beside and ampa, there could be a minute chance. Say, enroll iron nominal. It may a critique problem. And some of them can cause cancer, especially a nona momo freno, say chemical and druno. Me uba menchaya, me were right to say, because me integrative physician, me timi use chemical and answer hospital drew and a natural a drew. Now, so me tell you, natural in row and I'm patients. Natural. You can't have bala. And you said I natural so because you were review on me muscle phone so TV program so. Na send na ho den tie no so ya be man na ya trust so ya balu natural but ya be man na konum say do no anya doctor a obetima prescribe ni ya mawa wa koma betimi abosa am anya blood pressure na mpo wan hwe ya betimi anya cardiac arrest and as heart failure e natural e help pure help me modin chiro enti enianom na na etoto eniema Omonko the right person in chain. I mean, yeah, access you omo. Now our blood pressure was me kwa num. Dre bema me bema sorry. Who had high blood pressure? Say be na be 170 over 120 or 120 150. What say me kwa num. Dre bema just say bema na hu hia. Say be sorry agina na ne obada. Now what about blood pressure na your secret na one person be treat. Enti ye kan ko si say obi abusa me number. Now, member is here and son our last question about because I'm so nipa na come baby. Enti pacho so what will do this show?
Ubetimi abo.
Enti you know first number no is 079 04 603 418. Let me repeat him out. 07904 608. Sorry, 603, Pacho. 07904 603 418. Now the second number no 074 24 19 5841. I'll repeat that one as well. 074 24 19 58 and 41. If I show first number see you set time MY can some mechanic doors. But meaning say mobile me bre ebio ama masabe twaso.
Sure. Doc, my last question ewo ahanum. I say does the prolonged use of oral contraceptive in women affect hormonal imbalances? Then also into bracket less estrogen and leads to infertility. Does it lead to infertility?
Yes. First question, you know, so who tell you so contraceptive?
Just strong.
I say contraceptive, you know, almost one particular hormone be and a shemu. Pachoti any ye. Ade a friend contraceptive, ade a kuntia nyinsane. A contraceptive drugs no. Almost had one particular hormone be and attach it. Enti research kakra ya. We need more research on that. Memo kakra may come across which I say too much of it, can lead to too much of one hormone against the other. And you can say hormonal imbalance. Not just say estrogen, progesterone, prolactin, and a prolactin. Any thyroid hormones, there are some imbalances, and predominantly, estrogen and progesterone imbalances are very dangerous to fertility. And number one, and prolonged use of contraceptives and a certain type of contraceptive I have to say that contraceptive in your pills or any your injections or anything American sano. But in most cases, I have one hormone a dorsum, a woman a change the other. Interno can lead to hormonal imbalance. That's number one. And I about so say hormonal imbalance can lead to infertility problems in women and even in men as well. So I know you're number one. Second question,
I think so. What tackle Nimi, or if you want me to repeat the question again, I can repeat it.
Okay.
The question and then say, does the prolonged use of oral contraceptive in women affect hormonal imbalance? Then let's.
Good.
Then in bracket, he's also asking, less estrogen and progesterone leads to infertility. He's asking.
Oh, and you said okay. I'm so said okay, and my answer questions meaning say let's answer of one hormone against the other cause infertility. In the term behind I say hormonal imbalance, say 1:4, say 1:2, say 1:8, as to say a yes, pepe, and sana fertility, okay. Say a boroswa, a cause so infertility, papa.
Yo. Doc, ene ye better say ewo nimdie a wo a onso onam so ababe chire yen ne awunim se de be ye beboa yen eba no ye pomudin ho ensem a nyame yadoma next week ye besan edwa ba ne ahwe emema side no so when it comes to infertility in men na eno so ye di ho enkomo na mesre se yenje onse o last west saudi beja yen na afe obi hwehwe won so ababia obehu na abusuafo se wo koi so enso na uni eye OT media eye yen WhatsApp platform na so a me de Twitter room hono just click on the link and join our WhatsApp platform. Anytime that we are having a program, we will send you a reminder na onso watimi a join ye ewo jumadie so and it doc you better see bebre yenje wo last west na fe yemfa jumadie no embrawe.
Yo, Madam Sister Monso Munya Brena Mobebe Ebeshe Yembetie Yen. The Mekandia chat to say fertility wahum. A affecting nipa bebre lives. So the award ye. Obi o ha no choose to say on person or woba. And no de se be yen to name mono. Obi wa one reasons in tia on person be war. But so we are one more. Omo epa wo no mo person be wo no mo su be hu omoma no betimi ni omoma sebe atna together with the whole family no dia and you may catch you when say there is an answer to your question, there's an answer to your prayer. It's said Dr. Richard Eghan na hu no sa no and yet happen am ye juma o say abrochire London ha na metie but me wo clinic e wo Ghana honso so no omo ni me ebedi adanse papa dia kire mabo nipa bebre mako other places in Europe and so akwa hwa amanfo a success stories no a dozen enti se opese Unyamia, said number they are two several times. Me kind of last one and Sanamako. Name was all Remia Freme Nabuku appointment. Most of the time, I appointment based because me call and me abibri koyejuma. And Timo Lewisham on the high street. We are just opposite the Lewisham fire station. O Fremia, me mau further direction. Na mama appointments. Obabano na me ho no ma show. Me to me bo there a difference between many other doctors, no, and our private clinicians, no, brain and say me what time. Na many time on so amount. Say me see me hwe nipa be mienu, miensa enai kra ne. Na enough time for them to understand what I'm telling them. Me yen samum dan say me rasi omo. Not quite a different story. This is the difference. And in use to very effective, very powerful. Most of them are natural medicine, as I'm telling you. And you know, Obaba me honomoa. Very simple. You will lose some high street in the so. We are just opposite the fire station. Numbers no send ye a good a body so go on na waka be mean to me many entebia me hu na nketenketea me boboso e dia chiro 07904 603 418 07904 603 418. The last one is 07424 195841 07424 195841. Momodia Fre, a war na Yarabia. So, bear moment and yet, no so another problem. And see a banner fertility, a penny pabako, a show banny bemening. If you are ready, give me a call. Not say how pa senye, me who say how no. Just call me for an appointment. Na meye be that be that. Nemum need na so say we started treatment na menjai we dey koso me dia meka che wa no na obe hunu ne ebinum hunu a omudi ho awrusie me da se bebre so watie me.
Yo, doc, you better say nenumre. Ebusiafo nso a munya ebre ebe joining enedwumadie esonso. Ye da munyina ase se abre nyina mo beka ye ho emadwumadie no etimi ekoso. Abina ama Beatrice Benis, Cecilia C, Comfort, Andy Comfort Sego, Diana busiafo a mo ewo so nyina nyame enhira mu nyina me ankasa me teacher baako Paul Anoche. Teacher, nyame enhira pa Same onso nyame enhira. See you. Ora Marty Opoku Ernestina Letty John nyame enhira obibia mekasa me bobodi na hwa na ma mesi obi na akwaya problem mama me na me nso me pesa me ni obi abenya problem or platform me so nyame ya adoma ochina so yebedi eye asase ho ensem ewo Ghana when it comes to land acquisition in Ghana and also acquiring property in Ghana. So pesa otono cash payment plan mortgage ni nyina nyame ya adoma on time with TAPTAP send me the lawyer back over me the property developers and so ebeba and into bomodiana join me ochina on time with TAPTAP send na Friday so yeah the ask the lawyer jumedie no e de abro nyame ya adoma next week this same time me the doctor ebeba ni atwetwe enkomo afa fertility in men yebedi ehon enkomo nyame ya adoma next week and into nyame enka obi bia ho ye damase se mobe join here makramo.
My chef and party planner. You know we can't get to this retirement/birthday shinding go wrong.
Everything is almost ready, but small problem.
Why? What's up?
We are way over budget, Kweku. Everything is almost twice the estimate.
Alibaba, okay? No worries.
So with TAPTAP Send, I have got a cake and decorations covered for the year.
You handle the food.
If any extra expenses comes up, just text me or call me.
I'm off today, so I should be easily reachable.
Hey, Chairman, it is for day.
Say, no be easy, you. Chairman has time and money.
Would you
Allah, Kweku TAPTAP, Kweku do, Kweku that.
our chairman can call you.
Hey, Alande, Chairman send them.
TAPTAP Send.
Papa no.
Yes, people, still on the Joburg House and Fair and Charity Ball. We're going to be stopping in Birmingham, UK on the 11th of April. Let's go get it. It's a home for you, a home for the homeless.